In late September, the northern New York-based pharmacy chain Kinney Drugs elected John M. Marafa as its new president. Holding a degree from Albany College of Pharmacy, Marafa started his career focusing in long-term care and later transitioned toward community-driven pharmacy. Since then, Marafa has held leadership roles at Walgreens in the Northeast and then Kinney Drugs after joining KPH Healthcare Services in 2019 as Vice President of Government Affairs and Healthcare Services Integration. Now, as the president of the drugstore division, he shared his plan to expand the definition of pharmacy and focus more on community-driven initiatives in rural areas.
Oftentimes in certain communities, the pharmacist is the only quote-unquote healthcare provider that a patient has access to. And so really looking at, my vision for Kinney Drugs is to create this, healthcare destination that's unmatched by anybody around us.
However, Marafa said this will not be a cookie-cutter approach as Kinney Drugs covers a vast variety of communities in New York and Vermont.
Specifically, when you think about, our quote-unquote Kinney country, we have a variety of needs. Certain areas we are, like I said, the only healthcare provider in town. In other areas, there's saturations of hospitals, et cetera. And so we kind of complement them. In other areas, we serve and fill a need.
He added how the ongoing COVID-19 pandemic motivates him to contribute and grow the impact of local pharmacies, especially after watching pharmacies step up to the plate during pandemic months.
The pandemic really allowed pharmacy to stand out. We were one of the only, approved businesses to remain open during the heart of the pandemic, allowing pharmacists to showcase their talent as a frontline worker, and looking at the fact that they had the ability to interact with so many lives when the world was essentially shut down. And looking at what pharmacy did during that pandemic really gives me the energy to say we can do more, because this is just the foundation of what we've been able to do. And we've been talking about this for years. Pharmacists and pharmacy teams have been saying we could do more, we can do more. And we were finally able to and showcase all of the great things that pharmacy was able to provide.
Marafa now wants to focus on the patient-pharmacist relationship, allowing pharmacists to grow to a new potential.
When you think about the patient and the pharmacist relationship, a patient visits a pharmacy a lot more these days than they have the ability to visit their primary care physician. Patients are very honest with their pharmacist, and they have the ability to, kind of interact. And pharmacists know if a patient isn't taking their medicine correctly, and they have the ability to jump in and explain why they need to take their medicine. My main vision right now is to create a level of service and experience that nobody else can match. Really focused on, taking care of our patients and our customers, and then attracting the most talented group of individuals, becoming not only a premier healthcare destination, but the employer of choice for, New York and Vermont.
For ABC 50 Now in Watertown, I'm Isabella Colello. For more local news, go to informnny.com or download the ABC 50 mobile app.